Okay, let's talk about some of the real serious problems going on in medicine. Let's talk about the treatment of heart disease with surgery. Can't possibly work. Can't work. Doesn't work. Studies show it doesn't work. We're talking about the angioplasty business, and they do 1 million of those a year in this country. We're talking about bypass, which they only do 400,000 a year in this country. Combined, it's a $100 billion a year business, and 80% of the hospital, your hospital's income comes from heart disease. If you have a cardiac business going on there, 80% of their income comes from heart disease. Now, there have been some studies to look at the benefits of surgery versus medical therapy. There have been 3 major studies done. They were all done before 1990. There'll be no further studies done. They've already looked at the situation, they've expressed the results, and it doesn't work. The vast majority of people, we're talking about 90% plus, survive no longer with surgical therapy than they do with medical therapy. You say, well, what about the exceptions? You know, like you know, the widowmaker, left main coronary artery disease. Well, the CAS study says they don't live any longer. And how about left main equivalent, when all vessels are blocked up? Well, CAS study says they don't live any longer with surgery than medical therapy. What's the CAS study say? That's the most recent one done. The CAS study says, doesn't matter what the anatomy looks like, doesn't matter if it's left main, doesn't matter how many vessels are diseased. What matters is what has happened to the left ventricle. You know, what they did is they played the game, and then they set the rules. They saw that those people with left ventricle damage, expressed by an ejection fraction of 50% or less, have an 18% increased survival over 10 years. And they brag about it. Now, the truth is, angioplasty, now bypass has been done since 1968, angioplasty has been done since 1978. There is not a single study that shows that angioplasty prolongs lives. Not a single study. They do 1 million a year, and they get away with it. Can't possibly work. A recent article, I encourage you to read it. You can find it online. If not, go to your library. It was July 18th, 2005, Business Week magazine. The title of the article is Heart Surgery Worth It? And it's a review of the treatment of heart surgery. It's a review that, by the way, John mentioned a book I wrote in 1985. It's basically the review I wrote in 1985 of heart surgery. It doesn't work. In fact, one of the key authors, the key people who was interviewed in this article, Dr. Hadler, who is a professor at the University of North Carolina, Chapel Hill, he says bypass surgery in particular, he says, should have been relegated to the archives 15 years ago. I'd say 20 years ago. Read it. Your patients should read it. I hand this out to my patients. It's a great review. It's well written, uncontested. It's the truth. Now, why can't bypass surgery and angioplasty work? It's because they don't treat the killing part of the disease. The killing part of the disease is not the large blockages. The killing part of the disease is the tiny little fat-filled plaques that are volatile and burst and cause a blood clot to form. That's why we call heart attacks coronary artery thrombosis, because essentially all of them are caused by this mechanism. It's the little tiny pimples. Little tiny pimples on the inside of the arteries that burst like a pimple on a teenager's face, and as a result of the products of injury that are released, the blood clots, and that's why you have the acute coronary syndrome. That's why. Bypass surgery doesn't treat those. Bypass surgery treats the big blockages, the ones that are full of scar tissue and calcium, the ones that may be causing chest pain, but they're solid as a rock. In fact, to add insult to injury, the day after bypass surgery of a heart attack, what do we do for the patient? We serve them the same foods that brought them out in the first place. Here you have this teaching moment. You know, the doctor walks in, and the patient looks at the doctor with frightened eyes and says, "Doctor, I need cardboard not to come back here. What should I do?" "I don't know, but you better eat that cheeseburger. You need the protein to heal your wound." In every coronary care unit, including the Adventist ones that I've been in, they serve them the same foods that brought them in the first place. Do you understand that? I don't. Oh, yeah, they starting them on statin drugs as soon as they had a heart attack. Of course, that doesn't work, but how about doing something really radical like feeding them a healthy diet from the moment they had a heart attack? Well, that might be novel. So you have a situation where what they're bypassing is non-lethal disease. What they're doing angioplasty on is non-lethal disease. It's not the part that kills. The part that kills is the little pimple next to the big plaque that pops and causes the blood to clot. So it really needs to be clear that that's the problem. And of course, when you go in there with your angioplasty catheter, what do? You blow up the balloon, you cut with a laser or a knife, and what do? You create products of injury. And the consequence is the blood clots. And so 40 to 50% of the people so treated, their artery completely closes down in 5 months. Of course, now we have stents, right? So now it's only 20% due to cell proliferation. And there are other problems with that, but enough said. Okay, this is a reversible disease. This is not concrete. This is not cement in a person's arteries. Cholesterol and fat, they go into the plaques. They create the inflammation. When you change your diet, what happens is you change the equation, so now more cholesterol and fat come out of the plaque. The surface tension is decreased. They're less likely to pop the pimple, burst the volatile plaque. You bathe the plaque with cleaner blood, healthier blood, so it stabilizes the membranes. The other thing you do as soon as you feed a healthy diet is you remove the strongest clotting factors people come in contact with, and that's animal fat. Animal fat makes the platelets very adhesive, makes the clotting factors very aggressive, particularly clotting factor 7. So you just set them up for a clot by feeding them the rich American diet. As soon as you change your diet, I'm talking about hours after you change their diet, they realize the benefits. The risk reduction is there. So, diet and lifestyle, they reduce the major risk factors for heart disease, like cholesterol and triglycerides, high blood pressure, obesity, insulin resistance. Going back to Dean Ornish, he says, according to the PET scans, 99% of the patients stopped or reversed the progression of coronary artery disease. When we understand that this is a diet and lifestyle disease, artery disease, we get to treat a whole bunch of problems. It's just not the heart arteries. There are all kinds of arteries, all different arteries over the body that are compromised by atherosclerosis. And the arteries, they either supply insufficient amounts of blood or they close down, and as a result, they cause common diseases. For example, you close the arteries to the eye and you get macular degeneration. You close the arteries to the ears and people go deaf, they get tinnitus and vertigo. You close the arteries to the brain, you get a stroke. To the heart, you get heart attacks. You close the arteries that feed the aorta, the vasa vasorum, and the tissue strength of the aorta decreases and you have an aneurysm. You close the arteries to the bowel, you get bowel infarction. You close the arteries to the spine and you get back pain, you get degenerative disc disease. I mean, the clue to it should be degenerative. I mean, that's the clue to what causes it. It's degenerative. Degenerative disc disease. It's not like somebody picks up a Volkswagen or a piano and their disc ruptures. It's like they turn or take a step and the degenerated disc pops. It's a vascular problem. You close the arteries to the legs and they get intermittent claudication. You close them down really badly, you get gangrene. Now, a real motivator here is you close the arteries to the penis and you become impotent. Some people say that's worse than death. I wouldn't know.